Okay, so good afternoon, everyone. Thank you for joining us today with our second to last session in our Practical Climate Action for Caribbean Health Professionals series. Today, we are looking at how to conduct a climate and health survey. Feel free as you're joining to drop your name in the chat, tell us where you're from. And I think there will be an option to drop in your questions as well. So, those of you who are familiar, this is our monthly webinar series focusing on equipping health professionals with hands-on techniques, leadership strategies, and teaching tools for promoting climate action in different settings. As I said, today we're looking at how to conduct a climate and health survey. These are the key objectives. Broadly, we're going to be looking at that research process, conducting a survey, as well as communication strategies that you can develop using surveys and then integrating surveys into monitoring and evaluation. CME credits are available for Caribbean-based participants. So this session is with one CME credit. The CME survey link will be posted in the chat before the end of this session. If you are interested in getting CME credits for this, please fill that out. It will be available for 24 hours after the close of the session. We do have a Caribbean Climate and Health WhatsApp group. So if you are new to this series, please consider joining. You can get lots of information, updates, other series that are in development, access to the community of practice on climate change and health. I think a link for that will also be posted in the chat so that you can join that WhatsApp group. And a reminder that we have our last session coming up next month. This one is following on from today's session, and it's going to focus on how to write a climate and health paper for publication. So that is on Wednesday, June the 18th. Please look out for the flyer for that session and register. So moving right along into today's session, we have three fantastic presenters who are going to tackle conducting a survey from different angles. First, we have Dr. Marsha Ivey, a lecturer and associate dean, public relations at the Faculty of Medical Sciences at the University of the West Indies, St. Augustine campus. She is a practitioner in statistics and public health for over 20 years. She joined the faculty in 2017 and has been teaching public health and statistics to undergraduate and postgraduate students and serves on numerous committees within the university. Her research interests cover respiratory public health, health services strengthening, and climate change and health. She currently serves on the board of directors for the Thoracic Society of Trinidad and Tobago, the Trinidad and Tobago Public Health Association, and grassroots organization operating together in sisterhood in Trinidad and Tobago. Then we have Dr. John Kotcher. He is a research associate, professor, and director of research at the Center for Climate Change Communication at George Mason University, where he leads a dynamic team of faculty, postgrads, and graduate students who are all dedicated to exploring effective strategies for communicating about climate change and air pollution. Dr. Kotcher is also a co-PI on the Climate Change in the American Mind project, a series of national public opinion surveys carried out in partnership with Yale Program on Climate Change Communication, which investigates and tracks public attitudes towards climate change and support for climate policies in the United States. And then we have Ms. Patricia Smith Cummings, who is a public health professional with over 14 years of experience in strengthening monitoring and evaluation as an essential public health function in the Caribbean region. She has led and supported successful initiatives aimed at enabling effective, evidence-informed public health interventions, programs, and policies. Ms. Smith-Cummings is a monitoring and evaluation specialist and an M&E technical lead at the Caribbean Public Health Agency. So thank you very much to all of our speakers. We're going to get right into it, starting with Dr. Marsha Ivey. I'm going to stop sharing and hand over to you, Marsha.
Thank you, Lauren. Thank you for that introduction. Let me just get my screen sharing on. And I think everyone should be able to see my screen now. Could you confirm
Yes.
for me? Wonderful.
Yes.
All right. So as was said, I'm going to be talking about how to do a survey on climate and health, how to do surveys on climate and health. But I just want to preface this by saying these are going to be pointers. This is a short session, so at the end of it, it doesn't mean that you're going to be able to just jump right in and be an expert at it all. So this is just about pointers on how to do a survey and applications to climate and health. So by way of introduction, why climate health surveys, especially in the small island developing states? And basically, SIDS face disproportionate climate impacts in terms of rising sea temperatures, hurricanes, heat waves. And so surveys help us to essentially place the population level impact into focus. It helps us to inform action. And we can assess health risk, look at vulnerable groups, look at vulnerabilities across the board, even look at adaptive capacity of our countries. Surveys help us to fill data gaps in climate vulnerable settings, such as our small island developing states. So what we're going to cover is the step-by-step, very short to the point, step-by-step survey process, and look at key considerations such as ethics, sampling, and cultural relevance. So to start, we have to define the objectives and the scope. You're interested in doing some type of survey, you have to define your objectives and your scope. What exactly do you want to measure? You may be wanting to look at risk perception, symptoms, adaptation. Once you have determined what you want to measure, define your population. Is it the general population you want to do? Is it that you want to focus your study on children, the elderly, or people living on coastal areas, coastal communities? You also have to set your study, your objective in terms of spatially and temporally. So where is it going to be done and when? So for example, we may have an objective that says we want to assess hurricane knowledge in Jamaican communities in 2025. Yes, we want to do that, but we could focus this a little more. When we say hurricane knowledge, is it just broadly across the base, or do we want to have SMART objectives? Objectives that are specific, measurable, achievable, relevant, and well-timed. So we may change that original objective that we have to say we want to assess the level of hurricane preparedness knowledge among residents of Jamaican southern coastal communities by December 2025 or by June 2025. This way, we know specifically what we're looking at. We can measure it. It is achievable. It is also relevant to the communities and the country, and it is time-bound. Moving on, once we have those objectives, we want to have now design the study. And there are many different designs that we can use. But for the most part, we're going to look at three, just to touch on them: cross-sectional, longitudinal, or mixed methods. If we're looking at a cross-sectional study, what we want to do is just take a quick snapshot. We want to go in and take a slice and have a sense of what is happening at, for example, a community level, or as we'd had with that objective, what is happening at in these coastal communities. So there are different snapshots that you can take. If it is we're looking at longitudinal, then we want to have a sense of what is happening over a longer period of time. We might look at that same coastal study and we might do it for a period of 5 to 10 years. So we can track what is happening over time and we can get different types of analysis and trends. Mixed methods is a different approach. This is where we bring in quantitative and qualitative methods to get more depth. The cross-section and the longitudinal studies are typically what we call quantitative type studies. But then we want to mix in qualitative approach where we want to have the participants of our study go more in depth when we ask them a question. And that depth helps us to get a better understanding and a richer context to the study that we're investigating. So once we have our study design, we want to determine now, where are we going to actually get the data from? What are our data sources? And the data sources could be primary or secondary. If it's primary, then we know that we're going to be looking at new data. This is data what you're actually going to collecting for the very first time. So your survey, you're going to be going out to people, you're going to be asking questions, and you're collecting that data at this point in time. Because we're looking at climate data, we might want to also get data from our meteorological offices. So that becomes secondary data, existing data. The existing data can also be your hospital records, your different databases, and we want to match those two. So you have to think through, once you've thought about what your objective is, and you've pulled together your study design, where is your data going to come from? The third step is that who are the people we want to sample? And how many people do we want to include? So sampling is a method by which we're able, at the end of our study, be able to generalize to the population from which our participants came. And for that, we will also seek to have that they are representative of the population. Now, the sampling can be one which is done with when we have a sampling frame, or sometimes we don't have a sampling frame. And by a sampling frame, I mean we have a list of all the persons in a community. We put all those names in a hat or a box on a system, and we randomly pull from that. So there is a frame for us to work with. That allows us at the end of the day to be able to give each person an equal chance of participating in our study. We can do certain types of statistical analysis when we have these types of sampling frames. If we don't, and resources, we're resource strapped and all of that, if we don't have a sampling frame, then what we have is what we call a convenience sample, or we have a sample that we pulled by snowballing. So convenience sample is that whomever we see, that is who we're going to include in our study. Snowballing is where we talk about having a friend or a few persons that we have identified. We ask them to find others, and we ask those persons to find others. So for those of you from the colder countries with snow, you should have that concept well down, right? We're snowballing it. So once we have determined our sample and how we are going to be selecting the individuals to participate in the study, we want to have a sense of how many we are going to include. And that is where our sample size comes into play. And you really should get a statistician to help you to calculate your sample size. You'll have different formulas depending on the objective of your study. And there are different tools that you can use, for example, OpenEpi, EpiInfo. So we know what our objective is, we know what our study design is, we are determined how we are going to sample persons or sampling strategy, and we know how many people we want to include in our study. But we need to ask them questions. So we need a survey instrument. And your survey instrument is typically a questionnaire. or a data collection sheet if you're going to be using a database. You have to think through, for the objectives that you have established, what are the different types of questions you want to include on that study? So you might have demographic information, which is always important so for you to have a sense of who the persons are in your study. You might want to have exposure variables, risk factor variables. If it's a knowledge, attitude, and practice type of survey, questions that speak to persons answering about their knowledge, their attitudes, and their perception of the particular area that you're investigating. You want to have a balance between what we call open-ended and close-ended questions. Your open-ended questions, for example, if I ask, how old are you? And you respond, I'm 45 or I'm 32. That's an open-ended question. A closed-ended question is where you give the participant different choices to select from. So you would give them, are you in the 18 to 25 age bracket, the 35 to 45 age bracket? So closed. If it's a yes, no response, then it's a closed. You want to avoid what we call leading questions or double-barreled question. A double-barreled question is a question where you have two questions in one. So when somebody responds, you're not quite sure what aspect of the question they actually answered to. You have to think about the language that you are going to be writing in, the literacy level of your participants. You also have to think through in terms of cultural aspects and the cultural nuances in the population that you're dealing with. Some countries will have different population groups, and as such, for those population groups, you have to think about what are the different things that you need to adjust in your questionnaire so that they will be able to interpret and understand. And then white space. As simple as it may seem, white space is very important on a questionnaire, both for your interviewer and the interviewee, the person who's participating. If they're looking at the questionnaire, they don't want to see a cluttered questionnaire. So white space is important. Now, you can either develop a brand new questionnaire, or you don't need to necessarily reinvent the wheel. You can utilize a questionnaire that exists, especially one that is validated, a validated instrument, but you will have to adapt it for your country, your situation, your population. So those are things to bear in mind. As it relates to the climate data, you have to be careful about ensuring that you integrate your climate data source with your health-related data. So there are different climate variables that you may be looking at: temperature, humidity, rainfall. If it is you're looking at asthma admissions and how the climate affects those and the seasonality around it. You want to ensure that you match your health data by the location and time. So at the start, we spoke about that objective where we're looking at to assess level of hurricane preparedness, knowledge around hurricane preparedness in these coastal communities. You want to ensure that the climate data that you're going to be collecting is for that particular area and for the time in which you're actually collecting the data. So you want to make sure you match your health-related data to the location and time as it relates to climate. There are different sources of climate data out there. Locally, you should be able to get data from your Met offices, your meteorological offices, but in many countries, there are other sources of climate data as well. And globally, there are climate data sets that you can access. Geospatial matching is something that you might want to also weave into your survey. And if you're going to do that, you need to make sure that you collect the GPS coordinates around the areas that you're working. ethics. Now, one of the things that happens sometimes is that a lot of people do surveys, and they do surveys for different things, whether it is surveys for evaluating quality control, audits in institutions. Not everything requires ethics approval. But if you are doing a survey on Jot Public, where you're looking to take that data and you're looking to have evidence-informed decisions, you're looking to publish that data, you need to have ethics approval. There are ethics boards nationally, there are institutional boards as well. Every university has an ethics board. Most Ministry of Health have an ethics board, and in the Caribbean Public Health Agency has a regional ethics board as well. Your ethics approval, when you submit your you have to do up a proposal for what you want to do by way of your survey. You submit it and you get your approval. You really want to ensure that for what you're doing, you're minimizing risks to your participants. You want to ensure that there's confidentiality. But if it is your study has low risk, then you can request an exemption. Along with ethics is what we call informed consent. And informed consent is about ensuring that the participants in your study understand what your study is about. They understand the risk to them to participate in the study. They understand what they should get from the study. And they then consent to participate. Now, the consent can be a written consent, a verbal consent. And because we do a lot of studies online now, we build that into the questionnaire that we send out online, where they will check a box once they have read the information about the study that they consent. It is important also for you to pre-test your questions to ensure that they are clear, the length of them makes sense, and that is logical. A lot of times people end up on the field asking questions, and it's at that point they realize the wording is off. So pre-test. Pilot testing is another aspect. The pilot testing is about ensuring the quality of what you're going to be doing. You test your survey in full, the implementation and everything, on a group of persons that are similar to the participants that you want to sample, but that you will not be including in your study. So once you've finished with all of that, you can now go and collect your data. And there are different modes of collection. You can have face-to-face interviews. You can do it by the phone. You can mail it out, snail mail. You can do it online. And when you are doing that, then you have to think about, for these modes, how are you collecting the data? Is it paper-based or is it electronic? And if it's electronic, you have different ways that you can do it. You have SurveyMonkey, Google Forms, RedCap. These are different tools that aid you with collecting the data. So it goes straight into the electronic system, and you have a database that's built for you immediately, which you can upload into a statistical software for analysis. Interviewers. Your interviewers have to be trained. You want to ensure that they understand both the ethical aspects of your study as well as the methods around your study. You also want to ensure that if there are any questions that participants might have that they don't understand, that the explanation that is given is the same explanation that all of your interviewers will give. And then monitoring. Once your study is underway, you need to consistently check the data quality, check that your interviewers are still interviewing the way that they should, check for missing data, and also plan for your challenges. There are going to be challenges. It's a climate study. You know that you might have some weather issues. It might be a tarmac issues where the road doesn't go all the way up into a community, so you might have to do some hiking. So there are some communities where you might meet upon resistance due to crime that occurs in those communities. You have to plan for challenges. So once you've collected your data, you're now ready for your data analysis. And your data analysis is going to be based on the objectives that you started out with, the type of data that you collected and the sampling strategy that you used. That data could be that you just want to do descriptive, what we call descriptive analysis, just giving a profile of your sample, profiles of what you got, using simple means and percentages and graphs and charts. But if you want to make inferences about the population from which the study participants came, then you're doing what we call inferential statistics, and you're looking at associations and differences between the variables that you collected. And we have different statistical methods that go with that, parametric, what we call parametric t-test regression and non-parametric tests. And where appropriate, you can also include your GIS. And then the final thing is that you have done your survey, you have collected your data, you have done your analysis. It doesn't end there. You have to disseminate the results. You have to report what you found, because this is very important to give that feedback. Engage the ministries in your countries. Engage the communities that you conducted the study in, the NGOs. Use clear visuals, the graphs, the maps. Develop policy briefs, infographics. And for the academics, of course, it is about the publications. And you're going to be the idea then is to use these findings to inform policy and for adaptation and for planning. So I will stop by summarizing and saying we've spoken about surveys, and these are essential tools for action. You want to have a rigorous survey that will use actionable insights, and the importance is very important, the aspect of sampling and getting statistical support, ensuring that you have ethics approval, and to pilot first and scale with care thereafter. I will now hand back over to the moderator. Thank you.
All right. Thank you very much, Dr. Ivey, for an excellent presentation. I think that presentation has laid the foundation very well for how we can plan surveys broadly and specific to climate and health. A reminder to everyone is if you have questions for the speakers, for Dr. Ivey, please feel free to post them in the chat and we'll get to them at the end. All right, so we're going to move along to our next speaker, Kotcher. If you are ready. Right, great. We can't see your slides.
It would help if I turned on my microphone, wouldn't it? Well, thanks everyone. Thanks for having me here. So as Lauren mentioned, my name is John Kotcher. I'm Director of Research at the Center for Climate Change Communication here in Fairfax, Virginia, just outside of Washington, D.C. And Marsha gave a wonderful, impressive sort of overview of survey research and the considerations, the strengths and opportunities of using surveys. And so now I'm going to sort of take us to a slightly lower altitude here and talk about some of the applications that you can use surveys for, specifically in the context of planning, communication, and behavior change campaigns. And so I'm going to first talk a little bit about some of the principles behind that, and then talk a little bit, show you some real data to give you a sense of what that looks like in practice. So before I do that, there we go. Just a little background about our center. We consider ourselves a think and do tank. And so what that means is we conduct a lot of message testing research to see what strategies resonate with different populations to try and improve engagement on the issue of climate change broadly. A lot of our work tends to focus on climate change and health. We also do a lot of survey research to identify opportunities to enhance public engagement, which might entail just characterizing our audiences, understanding what values and experiences they bring to the table, But importantly, also things like who are the sources of information that they trust the most when it comes to climate change. And so we take that research, the message research, the audience research, and then we look to activate who are those trusted voices. And we apply the same tools of social and behavioral science that we would use in a general population to then identify what are the barriers to getting these messengers involved in the issue, right? So whether it's television weathercasters or health professionals that we're trying to activate as messengers on this issue, we use the same tools to try and activate them and empower them to be effective communicators, and that includes training them on the latest in the science of climate change communication. So as I was saying, for today's talk, I'll just start with a few principles on how you can use, Marsha mentioned there are different types of surveys, right? There's cross-sectional surveys, which are just a single snapshot in time, longitudinal surveys, or mixed methods surveys. I'm going to talk specifically about how you can use cross-sectional surveys for planning message strategies and communication campaigns. And again, I'll show you just an application using some of our US data. And again, as Marsha was saying, it's tough to sort of make people, help people become experts in one session. So really the goal of this is just to seed the discussion, and hopefully we'll have a great conversation after these presentations about all of this. So surveys can be used, as Marsha showed us, for a lot of different things, and even just within the context of communication campaigns and planning those, surveys can be used in a variety of different ways, right? They can be used to define our target audience. We can conduct audience segmentation analyses to identify sort of coherent groups of individuals who maybe share the same values on an issue. We can sort of define them in terms of how vulnerable those groups are, right, to different types of climate health risks. We can use surveys to choose the focal behaviors that we want to target in some sort of communication campaign, right? We can look to see what are the barriers that are preventing people from enacting certain behaviors. We can look to see are certain behaviors are already widely practiced or adopted in the population, right? We can also use surveys to identify the communication channels that people are most likely to be using. How can we best reach people once we've settled on a message strategy and a message? What are the best ways to disseminate those messages, right? So surveys can be used to assess people's media use and other information sources. And then, as I mentioned a moment ago, they can also be used to identify the messengers that we might want to activate and utilize in any kind of communication campaign. And as I think Patricia will be discussing after me, they can be used to provide feedback either while the campaign is still in progress as sort of an iterative process, maybe using a longitudinal survey design, or they can be used at the end of a communication campaign to evaluate the success. So I'm going to talk just today about a slightly a narrow slice of this, which is sort of at the front end when you're planning a communication or behavior change campaign. How can we use surveys to assist in the identification of promising message strategies? And so when I say message strategies, I'm not referring to the message itself per se, which is the result of a creative process in terms of figuring out what are the exact right words we want to say or imagery we want to use. Instead, when I say message strategies, I'm referring to the target beliefs that we are trying to influence with our messages. Because with those messages, we don't automatically change people's behavior. Oftentimes, in order to change people's behavior, we have to change their underlying beliefs and attitudes that are precursors to changing their behavior. And so surveys can be a really valuable tool in helping us plan these message strategies. And we can think about it in terms of a promising message strategy is one that satisfies three different criteria. One, we want to see that there are a substantial number of people who are not in the desired position on the message strategy relevant variable. We also want a message strategy where there's a substantial relationship between that belief and the outcome, the attitudinal or behavioral outcome we're trying to influence. And then finally, we want to target beliefs that will be responsive to actual communication campaigns, that it's feasible to actually change people's beliefs on that issue. And so though the language in that last slide was pretty abstract, here's the same thing much more simply. Are there many people with the wrong views on that belief, right? So maybe if people don't understand that smoking is bad for them, we want to change that, right? We want to help them understand the health risks associated with smoking. We want to target beliefs that have a strong relationship with the attitude or behavior that we're trying to influence. So do perceptions of the health risks of smoking actually predict whether or not somebody's going to smoke, for instance? And is it a belief that a communication campaign can affect? And we can't necessarily answer that last criterion with a survey. That will take, some experiments or just your own judgment in order to sort of think that one through. So it's really the first two that surveys will be most valuable in answering. So now I'll talk about what this looks like in practice. And just to sort of set the stage for this, we often say at our center, our mantra is that, the most effective thing for any public engagement effort to be successful is to have simple, clear messages repeated often by a variety of trusted sources. But it raises the question of what messages, right? And on an issue like climate change, we often say it's not realistic for everyone to become a climate scientist overnight, right? That's just not an attainable goal. But that there are certain things that if most people understand them, we kind of think it's a relatively good thing for them to know. And so throughout a series of research and just sort of experiential knowledge that we've accumulated over time, we've condensed down what we think people need to know about climate change into just 6 key facts. Number one, it's real, it's us. Experts agree about those first two things. It's bad, others care, but there's hope. And so by it's real, we mean that climate change is happening. It's us, meaning that human activity, primarily through the burning of fossil fuels, is the main cause. Experts agree, meaning that there's actually been, speaking of survey research, there's been a lot of great studies that survey climate scientists to assess what percentage of them actually are convinced that human-caused climate change is happening. And we find consistently in those studies that the vast majority of them think climate change is happening, and we can precisely quantify the percentage of scientists that feel that way. It's bad, meaning that it's not just bad for the environment and plants, penguins, and polar bears, but that climate change is harmful to human people in a variety of different populations. Others care. We find that people tend to systematically underestimate the extent to which other people in their communities, in their country, care about climate change and support action to address it. So it's important to emphasize that as well. And then this idea that there's hope, that the actions that we can take, both individually and collectively, will make a difference in addressing the problem. And so in our surveys, we can ask survey questions to assess the extent to which people subscribe to each of these different beliefs, that it's real, it's us, so on and so forth. And then we can look at the association that each of these beliefs has with maybe some more distal outcomes that we might want to influence in a communication campaign, right? So as people who care about climate change, we might have the goal of increasing support for policies to address climate change, either bringing down emissions or making us more prepared to withstand the impacts associated with it. We also might be interested in galvanizing people into political advocacy to support those policies, right? In some instances, we might be interested primarily in just sparking people's interest, right? Getting them to seek out more information, for instance, about how they might protect themselves from the health effects of climate change. And then we also know that interpersonal discussion is highly critical for influencing some of these other outcomes. And so just getting people to share information, share what they know about climate change could also be an important outcome of interest. And so I'm going to show you some data coming from our Climate Change in the American Mind surveys, which Lauren mentioned at the outset. We've been doing these surveys. These are nationally representative surveys of the US population that we've been doing every 6 months, going back to 2008. Each round of data collection is just a fresh cross-sectional sample. It's not longitudinal, even though we've been collecting these over time. And so each one is about a sample size of 1,000 participants. And the data I'll be talking about are specifically from spring of 2023 is when we collected them. So, we talked a little bit about the different ways that you can analyze data. These are just some very descriptive findings of the extent to which people sort of subscribe to or possess kind of the correct position on each of these different beliefs. And I can talk later, I have slides I can show in the Q&A if folks want to see the actual survey questions and how we assessed these. But we looked at the extent to which people think that each of these facts, believe each of these facts, right? And what we find, going back to that first criterion for promising message strategies, we find that about almost, over 7 out of 10 Americans think that climate change is real at this point. And so that leaves, maybe only about a quarter of the population to who you would actually be able to influence on that. So not a lot of people, not a lot of room for growth or movement in terms of communication campaigns. Then we have the belief that climate change is caused by human activity, a little bit fewer, a little more room for growth, but not a ton. Then we have the perception that experts agree climate change is happening. 54% of Americans are not in the sort of the desirable position on that. And here that's defined as thinking that 90% or greater of scientists believe human-caused climate change is happening. So a lot of room for growth there. The belief that climate change is bad, again, about 2/3 of Americans are already on board with that. Now, for others' care and theirs hope, we measured those in different ways. So in social science, you often hear about the power of social norms to change people's behavior. And those can be broken down into 2 different types of social norms. What we call descriptive social norms, which is our perception of the amount of effort that other people are, for example, the amount of effort that other people are putting into addressing climate change. So that would be a descriptive norm. Then there's something we call an injunctive norm. That's slightly different. It's our perception of how important we think it is to other people that we take action to address climate change. So on both of those, there's a fairly substantial amount of room for growth in terms of increasing the perception that others care about climate change. In terms of hope, we operationalize that in some different ways in this study. One way to think about it is something that social scientists call efficacy. In this case, it was how confident are people that working together with other people like themselves, they can affect what the government does about climate change or that what corporations and industry do about climate change. There again, we see quite a bit of room for growth. On the flip side, and this is where it really matters how you measure some of these things, we had another measure where we asked people to agree or disagree with a statement, and that statement was, it's already too late to do anything about climate change. Thankfully, most people disagree that it's too late to do anything about climate change. So there, only about 14% of people would say that they think it's too late. So not a lot of room for change there. So what happens then? So that's really the first criterion, right? Is where are there opportunities for change in these beliefs? The second criterion, as I mentioned a moment ago, is how strongly associated are these beliefs with the different outcomes we want to influence? So here, this is a big table with lots of numbers, but I'll walk through it with you very carefully. So each of the columns are the different outcome variables. These are the results of a regression model, which is a form of inferential statistics that Marsha mentioned in her talk. The bolded numbers are the associations that were significant. And so this is showing us where are there positive associations between our beliefs that we might target with a message campaign and the outcomes of interest. And so what we see here is, for instance, if your goal is to influence policy support on climate change, the beliefs that are positively associated with that are the belief that it's us affecting the climate, experts agree, perception that climate change is bad, and then our others care injunctive norms. There's hope, efficacy, and there's hope, opportunity. On the other hand, if your goal was to influence people's information-seeking behavior, others care is the only belief that was positively associated with that behavior. And so that would be really the belief you'd want to target in your message campaign. The other ones, it's a little bit more nuanced. So information sharing, both of the others care beliefs were associated with that. Political advocacy, it's us, played a big role. And then others care. And then the efficacy belief under hope was also important for galvanizing political advocacy. So this is a much simpler qualitative way of looking at those two criteria and how the data line up. So in terms of are there many people who have the wrong views on the belief? When it comes to belief that climate change is caused by human activity, yeah, there's some people who we might change. There's a lot of people who we might be able to change with experts agree, some with it's bad, and many people that we might be able to reach with others care or efficacy beliefs. Less so in terms of a lot of people already are convinced that climate change is happening. A lot of people are convinced that it's not too late to do anything about it. Then with those associations, again, if your goal is policy support, there are a lot of candidate beliefs that we might target with a message campaign. Whereas with information seeking, we have fewer good candidates there. It's pretty clear that you want to focus on others' care. And then a little bit more nuanced for these other ones. On the flip side, if you're looking at, well, are there any beliefs that we can target that might influence a wide variety of outcomes? Focusing on others' care seems to be your best bet if you have a variety of different objectives you're trying to achieve with your campaign, right? Particularly descriptive norms. So the boxes that are darker here, those are the ones that had the strongest association with that outcome. So others care would be a good way to focus on a variety of different outcomes. But again, something I'll just note here is you don't have to just choose one belief to target, right? You can construct messages that are designed to influence multiple beliefs. And so that really might be for, again, if your goal is to influence people's policy support for climate change action, that might be your best bet is to combine, find a message that can influence multiple beliefs. So anyway, I'll just wrap things up there. I hope I've convinced you that surveys can be useful for planning message strategies. One thing, this is not a surefire method for identifying the most, an effective message strategy. It's based on correlations, right? Just because there's an association between a belief and an outcome of interest or behavior doesn't mean that changing that belief will cause a change in that behavior. We need experiments to demonstrate that. And so the goal here is not to provide a surefire method of identifying better message strategies, but to provide one that will at least improve upon our intuition, right? That it improves our judgment in some way, even if it doesn't provide definitive evidence, right? And the other thing to keep in mind here is, the illustration I've shown you, this is just looking at the US population overall, right? There might be certain subpopulations where the patterns look very different, right? So you have to keep that in mind as well. And as I mentioned a moment ago, obviously message testing and evaluation is still important. We need to figure out if our messages can actually influence these beliefs. And so I think that's a great segue over to Patricia's talk, which I believe she'll be talking about the power of surveys to evaluate things. So thank you so much for your time.
Thank you, John, for that presentation. I can say, yes, you have convinced me. I'm sure you have convinced others as well. I think we don't always think about that next step after we conduct the survey, we collect the data, even we write it up and publish it, but actually communicating the information to relevant populations. I think that was a great overview of how to do it and some of the strategies that we can take. So thank you very much for that. We're going to move on to Ms. Patricia Smith-Cummings, who is going to talk to us about surveys in monitoring and evaluation. So we're taking it down another step. How else can we use surveys? Patricia, if you want, you can start sharing.
Yes, thank you very much. Just a moment. Confirming that you're able to see my screen?
Yes, it is not yet in slideshow.
Okay, good. Just a moment. And it should be in slideshow now.
Yes, it is.
Okay, thank you very much. So good evening, everyone. I'll be talking about and really sharing my experiences in the role of using surveys in program monitoring and evaluation. Just to set a bit of the context or the background for the presentation, I will be discussing a little bit about the Caribbean Public Health Agency, as in who we are, to provide some information as to our approaches and how we use surveys in our overall program monitoring and evaluation and also of our projects. And this will be followed by the purpose of surveys and the use of surveys in program M&E. I'll share a few of our experiences and lessons learned in the use of surveys for M&E purposes, and just share a few tips in conclusion. So a little bit about CAFA, the vision of the Caribbean Public Health Agency, which is CARICOM, I would say CARICOM's response or CARICOM's health response is healthy people, healthy spaces, and a healthy Caribbean. The organization is one that focuses on strengthening capacity of the CAFA member states with the purpose of preventing disease, promoting health and wellness, and this is done through leadership, partnership, and innovation in public health. Right. The mandate of the organization is to promote physical and mental health and wellness within people of the Caribbean. We provide CARICOM member states, which includes CARICOM member states, with strategic direction in analyzing, defining, and responding to public health priorities, promoting and developing measures for prevention of diseases within the region. We've also provided support to the region in preparing for and responding to public health emergencies. We also support solidarity in health, as this is one of the principal pillars of functional cooperation within the Caribbean community. And that leads to our final mandate, which is to support the initiatives and the achievements of the objectives of the Caribbean Corporation in health. So a lot of the experiences that I'll be sharing is focused on us and supporting the work that we do in fulfilling CAFA's mandate. Good. So for monitoring and evaluation and our mandate, just again to provide a little bit of context, from an M&E perspective, what we are seeking to do is to implement a process that supports ongoing and continuous observing and tracking of activities and progress. And of course, this requires having data that has been collected at multiple points or intervals throughout the project, policy, or program cycle. This is a critical component, of course, the implementation or the achievement of any successful intervention, policy, or program. From an evaluation perspective, it is a process of determining the worth or significance of a development program, project, or an intervention. And this, of course, also includes examining the efficacy of the design and the implementation, and then looking at the use of the resources and the sustainability of the results that have been achieved. So leading from evaluation, it is intended that this information that comes out of the evaluation and even the monitoring, that these will be incorporated into lessons learned that contribute to the overall decision-making process. So from a public health perspective, monitoring and evaluation is seen as an essential public health function. And the way that surveys connect to this is that it helps us to collect information, to gather information and data on health and well-being, equity, the social determinants of health, and health systems performance and impact, whether or not these are, regardless of how these are being determined or implemented. In some initiatives, it's an overall program. We have different types of projects, for example, climate and health projects, environmental projects, and others. And the data, of course, is needed to help us to determine our performance and the achievement of the results. So the data is needed, of course, for analysis and use to help to inform our interventions and our decision-making process. So the role of surveys in program monitoring and evaluation. I've outlined 12 specific, I would say, roles or purposes and how surveys have contributed to program M&E. And this includes the first one, which is baseline assessments, followed by evaluating program, project, or policy outcomes and impact. And I would like to say that it's in no specific order. It also helps to provide data as it relates to tracking health trends, monitoring progress, understanding the perspectives of beneficiaries and other stakeholders, informing program improvements once the information is utilized, accountability and reporting, improved patient care. It feeds information that would help us to improve patient care. It informs our program design and our policy decision-making process. I would say throughout the policy cycle, and I'll get a little bit into these as we progress, to identify also health issues, and finally, comparability. So looking at the first use, I would say a role of surveys is in the conduct of baseline studies, which is done, or baseline assessments, which is at the start of the program or project. And this helps us to collect data and provide information that helps with the analysis of the current situation. And I mean current situation as it relates to prior to the implementation or the inception of the program. So surveys help with establishing and having a starting or a reference point from which progress can be measured and assessed. Some examples of these include needs assessment, health assessments, environmental and education assessments. Secondly, evaluating outcomes and impacts. We have used surveys to measure the results to determine whether or not our programs or projects have achieved the desired objectives, and also to ascertain the changes that have occurred within our target population. Of course, this is important because when we're talking about outcomes and impact, we're looking at the changes that have occurred based on the implementation of an intervention that had specific objectives. So using surveys to capture information to support evaluation is very critical. And as it relates to tracking health trends, they help to collect information, or they help with information gathering that contributes to determining or identifying various types of behaviors and risks that provide valuable data to whether it be service providers and also program or project managers and implementers. This information can be used to support also prevention initiatives. As it relates to monitoring progress, surveys can be used to also track indicators. Excuse me one moment, please. Sorry, to help to track indicators. Indicators, of course, are measures that are used to determine whether or not we are able to measure our progress. What are some of the things that we have outlined within our project that we want to achieve, depending on the level of the indicator, being an outcome impact or a lower level indicator. The information that is used to gather surveys, sometimes this is done from a demographic health survey perspective, or also from a facility level perspective, or focused on different populations. But it depends on what measures that we are seeking to determine whether or not we've delivered as we have planned. And it helps us to use this information to track whether or not we are achieving our short-term results. We have a tendency in program monitoring sometimes to leave the monitoring component or to leave the measurement until the end. But with the use of surveys, there's the opportunity that allows us to measure as we progress. So we don't necessarily have to only wait until we are looking at the high level results, but we can measure progress as we are going along. Fifth is understanding beneficiaries' perspective. This, of course, is very critical, and not, like I said, only beneficiaries, but also stakeholders' perspective. And this includes using surveys to collect input and feedback. And this is mainly specific to beneficiaries of specific programs that have been implemented. From CAFA, we have, I would say, quite a lot of programs that are implemented through projects. And for example, we have programs with health institutions. So we have programs that address the HIV response. We have programs that address non-communicable diseases. We have programs that look at vector-borne diseases, tourism and health, and I would say a wide range of public health related projects and programs that are being implemented. And it is important within this process to engage with our beneficiaries to be able, or those that are part of the process and benefit from, in some cases, we're talking about hotels and not necessarily only from an individual perspective, or also maybe from a patient or a client perspective. In some cases, beneficiaries also refer to, I've referred to CAFA member states. So we're also talking about countries who are also beneficiaries. So the use of survey to capture perspectives, also provide their input as it relates to their perception of the program, and what sometimes there's a difference in what we believe we've achieved, and from the perspective of those who have benefited, what the added value of that contribution or intervention is, and what are some of the challenges that have been experienced in an effort, I would say, to improve our overall program management. 6 is informing program improvement, and survey data also is used to highlight areas that the program requires adjustments. This, I would say, is sometimes, I would say, maybe a little bit challenging, not necessarily only for CAFA, but I would say from my experience with engaging with other entities, whether it be non-governmental organizations, or whether it be ministries of health, or from other sectors. The learning component sometimes is a challenge. Even though we have the opportunity to use surveys, the challenge more focuses on the use of the results to inform course correction. We identify what our challenges are, we identify what our shortcomings are based on the data that has been collected and the information, but we don't always, in a timely manner, use the information for course correction. And that affects, of course, the effectiveness of our programs. 7th, for accountability and reporting. Surveys provide, I would say, valuable information. As we all know, some of the speakers that went before me, and even from some of the sessions earlier, discussed the use of, or the access to donor funding, and how best to approach donor and grant funding, and what needs to be done. Accountability and reporting is critical for donors, for policymakers, and also for stakeholders, and also for persons who are developing programs and projects and seeking funding. Use of surveys to collect data and information on the interventions or the programs or the policies that we intend to implement, or that we are implementing, shows that we are demonstrating transparency, and we are not necessarily only talking about transparency, and that we are being accountable with the resources that either will be given to us or that we have secured. And also, we also have to consider that this is also important as we look at donors assessing value for money. And this also is supported through reporting. So collecting information both from a monitoring perspective with the use of surveys, and also an evaluation perspective with the use of surveys, supports reporting and accountability. I believe we all understand and have an appreciation for the importance of accountability, especially in a resource-constrained environment. 8, it also helps to improve patient care. The use of information more or the use of surveys as a tool and an approach in healthcare settings for the collection of data that provides information on patient behavior, and also of risks, with the aim of improving patient care, that also leads to better health outcomes. I am aware of several instances where surveys are used, health surveys are used within healthcare facilities to collect information on services provided, or maybe it could be on incidents of fall or other incidents within the healthcare facility, that helps to support decision-making process. And also of recently in one of our member states, as it relates to a survey that looks and examines geriatric care and the services that are provided, with the intent, of course, of improving. Ninth, program or project design. Survey helps to provide data and information as it relates to potential risks. And this is very early in the process of the project life cycle. And also it allows the opportunity, if taken, to use a more proactive approach to mitigate and to reduce risks as it relates to project design and implementation. And this also provides an opportunity to have more of an informed project environment. So using more of a proactive approach. So we definitely want to be able to use data from through surveys from an early stage. 10th, which is to inform policy and planning. The data that has been collected through surveys have been used, of course, to inform health policies and planning. I will share just from, I wouldn't want to identify the country, but of recent, from experience where we had conducting a program monitoring and evaluation capacity building or training, I believe it was for about a week, with one of our member states. And usually in the process of conducting those trainings, we identify specific projects that they would like to implement. Maybe it hasn't been designed or planned as yet. And also maybe it's a project that has already started, but we use the opportunity from the workshop to use more of an applied approach to M&E as it relates to policy and program. That training was targeting policymakers. And as a result of that training and follow-up subsequent to the training, you know, one of the initiatives that came out of that was the design of rehabilitation, a center that supports that member states that with the intention of reducing the number, I would say mainly reducing the economic burden on the hospital setting that had persons that were in the hospital that needed to transition to a rehabilitation center. So from that training and using the M&E approach to do some of the needs assessments and to support the justification, coming up with a design and a theory of change of how this could be done and how it would be work and be cost effective, and sharing that with policymakers. That is something that was presented and accepted. And I know that is one of the initiatives that, you know, came out of some of the work that we've done with countries. So they help us to inform that process with overall improvement, not only of our policies, but also as it relates to resources. So reducing the economic burden in one way for one facility, and then providing support to improve health outcomes for the patients at the same time. 11th, which is to identify health issues. And of course, this is done a lot. UNICEF, for example, does a lot of surveys as it relates to demographic surveys and national surveys, the multiple indicator cluster survey that's also done, and some other countries do other national surveys. And the use of these surveys, and even as we look at data over trends that come out of the use of these surveys, this could help us to also identify some issues within some subpopulations or in the general population. Most recently, some data that recently came out of studies that was done identify for some countries that for some disease areas, for example, as it relates to sexual transmitted infections, that there was an increase in certain populations also as it relates to strokes. And when we look at maybe like the 10 leading cause of death and other areas that we are examining, then surveys could help us to respond to those. Finally, it provides the opportunity for comparability. So this allows us to do some level of meaningful comparison of the data that has been collected previously, and comparability as it relates to looking at data across time, various populations or subpopulations. And this helps by providing information and giving more insight as it relates to trends, patterns that exist in the data reflective of the population, and also I would say taking into consideration what has been presented before and having high data quality, being able to provide some insight as it relates to some of the generalization of those findings. Moving on to lessons learned, I identified 3 lessons learned. I know that other persons have already shared as it relates to surveys and certain things that we must also remember, but from an M&E perspective, as it relates to the use of surveys for program monitoring and evaluation, I would say don't forget the theory of change. This is very critical. We must remember that surveys, we're looking at it from the perspective of an approach or a tool that is used to capture information and to capture data. From a program perspective, what has been designed to drive change is the theory of change. What it is that we will input, what are some of the initiatives, activities, or interventions that will help us, I would say, that will be used as a vehicle to get us to the desired results. The desired results may be maybe a reduction in vaccine preventable diseases, for instances. But we must always keep the theory of change right at the forefront while we are collecting information and we are using whatever method to collect this information, ensuring that the questions that are designed for the survey will help us to respond and to be able to measure the intended outcome. In some instances, if this is not done, I would say intentionally, or if we kind of forget the theory of change in our designs and in our approach to surveys, then sometimes we will end up with information that helps us not to respond to the questions. So we've collected data, maybe we could use it for another purpose, but it does not answer the questions. The next one is to test, and I would say test again. I believe it was Dr. Ivey that spoke about pilot testing of surveys. So this really is an iteration of the importance of testing and pilot testing again to ensure that the survey and the questions meet the intended purpose. I cannot say this enough. We've done evaluations and assessments and it is a challenge, I would say, and in some instances from an evaluator's perspective, what you can say really, is that even though you can use the survey as a method and as a tool, because of how your programs are designed or maybe certain objectives, they are not very clear. We talked about having smart objectives and looking at those. Then even if we have the best tools, we are still not able to measure or using what our intended purpose is. And then finally, to remember cultural context. We implemented an initiative that, from a communications perspective, focused on communication and targeted indigenous populations in 5 Caribbean countries, and even more so, cultural context. And even, I would say, from even when we consider a country context and even a Caribbean context, these are things that must also be taken into consideration in survey design, design of questions also, because it may require, even though we do have, I would say, vulnerable populations or indigenous populations that we are also working with, what we are designing as it relates to surveys has to be tailored sometimes to be a bit more specific, taking into the sensitivity of the culture and the cultural norms, and also maybe some of the potential biases. I know we had done that initiative in Belize with the Mayan communities, and even with the design of some of the communication messages that were shared during the COVID-19 pandemic, and maybe even engaging sometimes the population that we are working with. Sometimes we have representation, but it's representation of organizations that represent populations. And when you have the opportunity, now you've designed your tool for your program, you want to assess whether or not you have been effective and you've achieved the results. And when you get on the ground, I would say, and start rolling out or implementing, then you realize in the design, the input that was received, It could have been, I would say, a bit more tailored specifically if we engage directly with at least a few persons from those populations. So testing within those populations themselves is important to success. And in conclusion, I would like to share, I would say, 4 tips. Just to remember that survey is a cost-effective method to collect data and information on our programs very quickly. It provides us with, as we know, conducting surveys, even from a national perspective, is very, very expensive, which is when in many instances, secondary data is used, but it is not always applicable dependent on what it is that we are measuring. So when the opportunity arises, then of course, it is a very, very useful tool. We have to be very intentional in our survey design, considering our program goals, objectives, and the intended results. And this also is connected back to the theory of change in the design of our surveys. It is important to plan early. I know we talk about planning early, but from a program perspective and from an M&E perspective, there is the natural tendency to bring M&E on at the end. So it is, we've already done our design or implementation or funding or resources, have basically been depleted. And now we need to be able to report and be accountable in saying, what it is that we have achieved. So while you will do the best that we can at that time, it is important to plan early for M&E and to also plan early for the conduct of data collection using surveys and other methodologies. And finally, to be flexible. Dependent on our population, dependent on the program, the project, dependent on the focus area. We have to definitely, I would recommend, and for us, we have to be very flexible as it relates to the types of adjustments that may be required, and also the use of multiple approaches in conducting surveys. Sometimes what works in one environment, in one country, in one population doesn't necessarily work in others, even though we must ensure that our tools are standardized and ensuring the accuracy and so forth of our data and the validity. But from a program perspective, some flexibility is required. With that said, I would like to express my appreciation to the team and thank you for allowing us to share our experiences with program evaluation and the use of surveys in that process. Thank you. Over to you.
Thank you. Thank you so much for that. I'm new to monitoring and evaluation, so that was very useful and informative presentation on how monitoring and evaluation can be integrated into surveys and how we can use surveys with it. So thank you to all of the speakers for fantastic, informative presentations for this session. I think everyone did a great job, and I'm sure the audience agrees that we have all learned a lot from the presentations. I want to invite the speakers now. If you want, you can turn your cameras. We do have a few questions. We may not be able to get through all, but we will try our best. So without further delay, first question, this is from Ryan Abraham. Dr. Ivey, this one is coming to you, but I think any of the other speakers can chime in as well. So Ryan is saying that a lot of times reports go to health ministries and policymakers, which can take months to be looked at, but often the results aren't always communicated to the participants or the community, which took part in the project. And they themselves are the ones who can benefit most from the inferences observed. What do you think can be done to enhance delivery of findings to these populations to facilitate corrective actions?
Thanks, Ryan. So that is a very good and relevant question because it happens all the time. So one of the things, and Patricia kind of touched on it a while ago when she said M&E is typically left at the very end and everybody is scrambling after all the money is gone to factor in M&E. So what I put in the chat is that M&E needs to be at the table at the start. And it's the same thing for your communities. If you're going to be doing a community-based study, bring in the activists from the community, bring in the community focal point, include them at the stage of planning your study. That way, at the end of the study, one, it is something that they have agreed to, that they're involved and interested in, and your results will then be relevant to them. They will then organize or help you to organize feedback to the community members. So when we're thinking about doing our surveys, a lot of the times we end up in our own little silos, planning things and coming out with great results, but it's not actionable. It's not necessarily relevant. So bring them to the table, community members and NGOs. NGOs are very important, and they help to move your work along in the communities as well. So that's one way that you can easily get your results shared at the grassroots level.
Great, thank you, Marsha, for that. We'll send the next question to John now. This one's for you. In the work that you presented, you presented some of the research that you've done. Have you noticed any correlations between behavior and beliefs at a global level? I don't know if you've done it at the global level, but anything that have you noticed with respect to those two variables?
Just trying to think. I mean, so much of our research is based in the US. Just trying to think, our partners at the Yale program on climate change communication have recently partnered with Meta, the parent company of Facebook, to do surveys in a variety of other countries and try to replicate our findings. But yeah, I mean, that's part of the appeal of these variables that I talked about, of it's real, it's us, experts agree, is those are universal beliefs to target regardless of where you live in the world. The actual associations between those may vary from one population to another. It may be that in some places it's really important to just convince people that climate change is happening, whereas in other populations it's more important to talk about the fact that there's hope. And even within the US, again, I was just presenting data for the US population overall. There's heterogeneity even within the United States. And one analysis I didn't present tonight is an audience segmentation that we've developed here in the United States that we call the 6 Americas of global warming. And they broadly are distinguished according to the amount of concern and support, the amount of concern they have about climate change and the support they have for action, right? Whereas the most engaged, we call them the alarmed, whereas the least engaged, we call the dismissive. And the dismissive, they aren't convinced that climate change is happening at all. They think it's a hoax. Whereas the alarmed, they understand that climate change is happening. They're convinced that it's a threat. They need messages about the fact that there's hope. They need messages about what are the actual actions that they can take to address it. And so I imagine it's a similar case in many other countries.
Okay, great. Thank you. I think we have time for just one more question. And Patricia, this one is for you. Can you talk more about why using surveys to improve programs can be so tricky? And if you have any tips for building better surveys?
Thank you for that question. I would say it could be a little bit tricky. I'm sorry, mainly because it is important I was saying it is important really to plan early. This, of course, is very critical because from a program perspective, and this is why I also identified the theory of change and the use of the theory of change as a tool also that could be used. And this is because sometimes we use surveys and we design the questions. We have, I would say, an idea or a concept of what it is that we really want to measure, but sometimes the measurements that we are using for the surveys, they do not help us to respond to the questions. So the questions are what it specifically it is that we wanted to achieve in the theory of change. So it could lead to having information that I don't want to say is necessarily useless, but information that does not help us to fulfill the purpose of why we originally decided to conduct the survey. So I would say connecting the surveys, which is why, of course, a theory of change is developed at the start. So if we are looking at designing program evaluations and monitoring, you look at designing your surveys and your instruments from the start. I also would like to mention, and I saw it also in the comments, the use of statistical softwares and packages and the use of statistics in M&E. So I would say that is one of the motivating factors why I studied development statistics with a focus on social and demographic statistics, because the use of statistics in surveys and in M&E is even more so now important because it provides an added soundness and validity and credibility to program M&E overall. Thank you.
You, Patricia, I feel like you and Marsha could probably have a conversation afterwards about statistics. So we need to wrap up. We are just a few minutes over time. We don't want to keep anybody back. I want to say a special thanks to all of the presenters for your excellent presentations. I think the interest from this and the other questions that we have probably indicates that maybe a further session on this topic might be useful for our audience members. A reminder that the CME link is posted in the chat. For those of you who are interested in getting CME credits, please fill it out. It remains open for 24 hours. And our next session and last session in the series is next month on June the 18th on getting published, how to get a paper published in Climate and Health. So we invite you to register for that session as well, where we're going to have other speakers from editors and other persons who have been involved in research talking about that editorial experience as well as an author experience. Reminder as well, we do have the WhatsApp chat. Feel free to join. We can try to address other questions on that WhatsApp chat by reaching out to speakers to get answers for any unanswered questions. So thank you very much again, everyone. Thanks for your participation and attendance in today's session. Thanks to the organizers for this webinar series, and we hope to see you all at the last one next month.